LetsStopAIDS has conducted the first national survey about the impact of COVID-19 on the sex lives of young Canadians aged 18 to 24. The findings show that the pandemic has had significant impacts on their sex lives. Ready to see what we discovered? As we reveal the results, there will be interactive opportunities, including chances to discuss topics that are brought up in the report. This session aims to raise awareness about how the pandemic impacted sex and sexuality and to explore solutions to common issues. During the session, remember to listen out for answers to your board game.
Hi. First of all, whose idea was it to have me follow the drag queens and MPP Chris Glover? Jamin? Rianne? Dana? Who thought, let's talk about research. Let's make research fun and exciting after drag queens. And an MPP who brought notes up but didn't even use it. I have notes and I'm gonna use them. My name is Dr. Yvonne Sue, and before you think I'm a medical doctor, I'm not. I am a doctor of philosophy, but I don't study philosophy. I'm a social scientist. It's very confusing, but that's my title. I'm at York University, and I volunteer as the head of research for LetsStopAIDS, and we conducted what we know is the first nationally representative survey on the impact of the pandemic on youth. If you think about it, when the pandemic started, there was all this media craze about people, whether they're having more sex, whether they're having less sex, whether there's more sex toys, but it was all focused on adults. And a lot of people, especially those who are from 18 to 24, were just ignored, right? Even though their lives are being completely turned upside down. And if you think about it, they're actually one of the most vulnerable in the pandemic, right? And that's because they're the lowest earning people, right? Of course, there are seniors, which had got a lot of attention. They're very vulnerable. But young people, a lot of people had to move back home, right? And sometimes those were not safe spaces. And a lot of people lost even their part-time jobs. And young people also don't have savings, right? So this is a group that was being looked over by policymakers, by researchers, but not by LetsStopAIDS. So I'm going to share some research with you. I'm going to, first of all, tell you the question we asked. I'm paraphrasing it because, you know, the real question we asked is very scientific and boring and long. So I'm going to get you to think about how you'd answer it, but don't say it out loud, okay? I'm going to ask you about sex and stuff. So don't get too excited and blurt your answer. No, we're gonna respect your privacy. And then I'm gonna reveal the stat, right? The answer for that question. Again, across Canada, over 1,000 young people were surveyed, and they're representative across the region. And we tried our best to get people who are from the LGBTQ+ community, as well as Indigenous communities and other vulnerable groups. So that's how it's gonna. I'm gonna tell you the question we asked. I'm gonna then share the stat. And then I'm going to ask you why you think the stat is the stat. Okay, so I need participation from you in exchange. I'll make some funny moves and gyrate a little and try to be a drag queen. Okay? All right. And I will read my notes. Damn, Chris. All right, so this summer, this is the question. This summer, when lockdowns were all lifted, when you had penetrative sex, how often did you use a condom? All the time? Most of the time? Sometimes? Never. So think about it for yourself. You know, all the hookups you've had, all the fun times, not so fun times. It happens. Okay? All right, now that you've got your answer, here is the statistic we found. Again, 1,000 people, young people across Canada. The number of Canadian youth who say they never use a condom, right? Never use a condom during penetrative sex doubled this summer compared to pre-pandemic. Okay, I'll let that sink in for a second. The number of people who said they never used a condom was 16% before the pandemic. And then in the summer, when lockdowns were lifted, it jumped to 32. That's very high. And I'll put it simply. So if you go out with 3 different people on 3 different dates, the chances one of them will ask you to do it without a condom or be very like coded with their message, like, do you want to do it old-fashioned? A girlfriend of mine got that and she was like, what is old-fashioned? She had to ask me. I'm like, I don't know. We have to Google it. And it means without a condom. Or like, do you want to raw dog it? That's not sexy. That's old-fashioned sounds better. So yes, isn't that wild? That 32% said they never use a condom this summer when lockdown's lifted. So the question I have for you is, why do you think that's the case? Why did more people decide to never use a condom when lockdown's lifted? This is rational. There are answers. And it's not just that young people are irresponsible. That is the stereotype. This is actually very rational. Come on, guys. Yes. Oh, sorry. You put your hand up first. You go, and then we'll go over here.
People were so stressed and isolated that any form of companionship that came their way weighed way more than safety or security.
Yeah. People were very lonely. People didn't get touched, right? So they want to feel the real feeling. Okay. We have some answers over here. Can you say that again to the mic?
Oh, less access to condoms, like free condoms in public spaces, and condoms are expensive.
Yes, that's very true. Absolutely. And also with all the concerns of inflation, right? Anything else? Okay, another important component is that it's actually just calculus. People had sex with less people during lockdown. So when you have that conversation where you're like, should we use protection? You're like, well, how many people did you have sex with? You're like, nobody. Or 1 or 2, right? So young people are actually doing a risk calculation in their heads, right? And then they're like, yeah, so it's perfectly fine not to use a condom. However, this risk calculation is delayed because their sexual activity during the pandemic with the lockdowns, where you can't go anywhere, where you didn't have sex with many people, is very different than when things opened up. Does that make sense? So they have a risk mindset of during the pandemic that they're applying to, quote unquote, post-pandemic, when people were having more sex. And this is why they're not using condoms. And later on, we'll find out they, as a result, get STIs. All right, second question. When you were dating during lockdowns, did you have sex on the first date? Think about it. Okay, and here is the stat. 34% of youth on online dating apps said having sex on the first date has increased compared to pre-pandemic due to lockdown restrictions. That's 34% of people who are having sex on the first date, even though they don't really want to. So why are youth asking, yours or mine, more often and sooner? Come on. Why would that happen? Why would you end up having sex on your first date even though you usually wouldn't? You have a 3-date rule. Maybe you have a 5-date rule that you lie about to your friends. Come on.
Maybe because people are just bored.
People are bored? Okay, yes. People are lonely, right? What other reasons? Gosh, that's so sad. They're not sure if they'll be able to see the person again. It's like a we only have tonight situation. The lockdowns might come again. Okay, that's good. But the other, yes? Ben? Nowhere else to go but home. And that is the real answer, right? And the other thing that we learn in speaking with people who work in universities, who deal with sexual assault, unfortunately, and sexual violence, is that what happens is there's just no public spaces. So you end up going to someone's dorm room or someone's house, and if they moved in with their parents, you're not going to be Netflix and chilling in the living room, are you? No, you're going to go to their room. You enter their room and you're like, okay, this is cool. And you're like, wait a minute. We're either going to sit at the computer desk and share a chair, or we're going to sit on their bed. Oh, this is so awkward. This is not sexy, right? So then you sit on the bed, and next thing you know, you've entered someone's bed, even though that is not technically what you agreed to. And then you're under the covers because that's so awkward. Are you going to sit above the covers while you're doing something? No, right? So a bunch of structural issues because of lockdown lead people to end up sending signals, firing signals that they might not intend to, and then being in such an awkward situation they can't get themselves out of it. And as a result, a lot more young people, like we said, our survey found 34% end up having sex on the first date, even though they might not have wanted to. And that's really important to highlight, especially in situations of universities when first or second year students are the first time they're away from home and they don't have many resources. All right, next question. Are you more concerned about your mental health, financial health, or physical health? This is during pandemic time. During the pandemic time, which of these, we're still in the pandemic, but you kind of know what I mean. Were you more concerned about your mental health, financial health, or physical health? So this one was a bit shocking to the team when we found it. And the answer is 74% of young Canadians reported worrying about the pandemic's impact on their mental health. And this is higher than their concern for financial health, which was only 69%, still quite high, and their physical health, which is 64%. So that did surprise us. And the question is, why is it such a critical time to care about the mental health of youth? Come on, this one is easy. Why? Yes, there's a lot going on in the world. A lot on your mind and not that much to do, right? Can't even go to the gym. What else? Anything else? A lot of stigma? Yeah, that as well. Any other answers? Yeah.
Just taking the brunt of the impact with no school and stuff.
No school? Yeah, if you think about it, a lot of people miss big moments in their life. A lot of young people are supposed to go to proms. What happens at proms? You dance with people, you have sex, you make mistakes, right? And those opportunities are taken away from them, or graduations, or your first year at university, right? So many of these key moments. Or people made 2 to 5 year plans where they were going to date for the first time and have a serious relationship. And all of that is gone, all this personal growth that you had planned. Maybe get your first serious job, right? Maybe move out, leave your parents for once, right? All that was taken away. So yes, mental health is really important, and it seriously impacted a lot of young Canadians and will continue to. All right, another question. If you were diagnosed with the STI this summer, did you seek treatment? And I guess hypothetically, if you were diagnosed with the STI, would you seek treatment? So this was also very shocking to us, because this summer, 28% of youth diagnosed with STIs did not receive treatment. And you saw in the beginning of the video, a lot of people got gonorrhea. So imagine you got gonorrhea and you didn't receive treatment. So what are some barriers to seeking treatment that you can think of? Why did these young people not seek treatment? Yeah. Lack of access. Yeah. All of that, right? And then that's something that LetsStopAIDS has found during the pandemic, was just not many spaces to give access, to give information, to just make it accessible, and also stigma, to make it say it's okay to have this, because everyone was so focused on COVID that a lot of the centers that they previously used to test for STIs and treat STIs were actually closed and switched over to COVID centers, right? So we need to be mindful of that in future responses to pandemics, where we just don't switch all of our healthcare over to the pandemic, because it leaves other really important issues like STIs to fall through the cracks. Now, lastly, Hopefully this crowd will know the answers to this. Do you know what PrEP is? Do you know what PEP is? And what does U equals U mean? Okay, many of you know this because this crowd. But we asked young Canadians, again, over 1,000 of them across Canada, and we were very shocked by the lack of knowledge. Some of you might not be, but it is also disheartening. So the stats we found in terms of PrEP is that only 26% of youth have knowledge of PrEP. And this is just knowledge, just like a yes, no, not like in depth or anything. 26. Only 20% know about PEP. And only 11% of youth know what U equals U is. Those are really low stats for, I would argue, a population that should be quite aware of sexual health, and many of them are starting their sexual journey for the first time, and they don't have the information. And more stats on this, 81% of youth that know what PrEP is, right? So of the people that know what PrEP is, we asked them further questions, and 81 of them doesn't know how they could start it. So even the 26% of youth that said that they know what it is, the majority of them don't even know how to start it. So they might just know what it is, but any further steps is not, that knowledge is not there. Yeah, like how to get on it, where to access it, what exactly it is, how do you take it, right? They just knew of it. So I'm saying that that's really sad because only 26% knew of it. And when you drill down further, we know that 26% the knowledge is very shallow when 81% don't even know how to start, how to get on it. And then here's another one that is also really fascinating, which is that 52% of the young gay men that we interviewed had no information about the cost of PrEP. So this is a demographic you would imagine that would be advertised this, with no information about this. Many of them didn't have an idea how much it might cost. And cost is often a barrier to access. And to answer these questions, because I'm not gonna bother you guys with it, is Pam. That's our next speaker. Pamela is a 2020 graduate from the University of Toronto's Faculty of Pharmacy, currently practicing as a pharmacist in a variety of settings, including community, hospital, and primary care. Her passion for LGBTQ+ advocacy started as a student, where she is the co-president of Pharma Pride, the pharmacy student advocacy group for LGBTQ+ in healthcare. Super cool, Pam. From there, she has been a guest for LGBTQ+ focused panels and podcasts, as well as a speaker and presenter for continuing education modules and conferences where she shares her passion and knowledge. She continues to work with LGBTQ+ folks at the Ontario Prevention Clinic / PrEP Clinic. Please give a round of applause for Pam. And then we'll do questions and answers after.
Hi. Thanks for having me. I may have lost my voice shouting for the drag queens, so please take that into account. My name is Pamela. I also go by Pharmacist Pam, and I am a clinical pharmacist that works at the PrEP Clinic or the Ontario Prevention Clinic. I also work in the COVID space at Toronto East General Hospital, so this does ring a little true to home. My pronouns are she, her, and for the next 5 to 10 minutes, my goal is to explain what is PrEP, what is PEP, why don't more people know about it, what can we do to fix that? So, PrEP stands for pre-exposure prophylaxis. It is a medication where it's one tablet with 2 different types of medication inside, and if you take it as prescribed, can reduce your risk of getting HIV up to 99%. There are 2 things I do want you to remember with PrEP. First is that it's very effective at reducing risk of getting HIV, but only HIV. So it should not be your only form of protection. Please continue to use condom use and safer sex practices to help reduce your risk of HIV and any other STIs. Second thing is, PrEP is pre an exposure. So it's something that's already in your body prior to a high-risk encounter. And that could be depending on the types of activity you perform or performed on you. 7 days lead in, 21 days lead in, 2 tablets. Please speak to your healthcare worker so that we can see what best fits you. But it's something that's already in your body and will continue to stay in your body to help reduce your risk of getting HIV. PrEP should not be confused with PEP, or post in exposure, so post-exposure prophylaxis. So this is a little different. So if you had an at-risk encounter where you think you might have been exposed to HIV, within 72 hours from the time of that exposure, you want to pop into the hospital's emergency department. The earlier you get on it, the higher the chance of success. It's over 80% effective. It's typically 2 tablets, always 3 or more different types of medication. It's 28 days of medication. You'll be doing blood work right away, typically in a month, at 3 months, and at the 6-month mark. And if you test negative there, you're in the clear. So that is PEP. So once again, PrEP, 99%, usually taken every day, taken in advance. PEP, taken within 72 hours of an encounter, 28 days, 2 tablets, over 80%. Okay, now that we know what PrEP and PEP are, why don't more people know about this? So, as I was getting a little more intimate with PubMed and some journal articles online, there were 2 main themes that really popped out on why more people don't know about these 2 amazing tools to help reduce getting HIV. The first one is stigma. So there's a lot of stigma surrounding talking about sexual health, sexual behaviors, particularly also in youth. Youth, especially now, may not be comfortable with sharing their sexual health with their family, with their guardians, maybe not even with friends, and also not with their healthcare providers. If you don't initiate that conversation, whether that be from the provider side or from their side, we can't talk about things that can help reduce the risk of high-risk encounters. Second thing is with stigma, it can also come into the people that may know about PrEP, so people that are in the 2S LGBTQ+ community that they themselves are on PrEP may not be comfortable sharing that information. And the reason why is because they are scared of the backlash they may face. Slut shaming, homophobia, transphobia, whatever phobias, and these are genuine fears that people have. So stigma is a huge reason why people may not want to share the information, or they aren't able to share the information. Second thing, aside from stigma, would be lack of knowledge. So people can't share what they don't know. And if you don't know, it is what it is. And not every pocket of community or people know about what PrEP is. And the pockets that do know PrEP, they don't talk to the pockets necessarily that don't know about PrEP. So this information isn't being relayed. This lack of information also falls onto the healthcare worker side. So, for example, I went through 4 years of undergraduate school studying life sciences. Then I went through 4 more years of school studying pharmacy. So that's 8 years of school learning about things that are supposed to prepare me to enter the healthcare sector and be a good provider. In those 8 years, I've had 1 focused lecture on HIV. In that lecture, I maybe had a slide, or maybe it was a paragraph, maybe it was a bullet point on PrEP-PEP. Can't remember, it wasn't emphasized in our formal training. And I can't be the only healthcare worker or student that's fallen into this situation. So it's not that healthcare workers don't want to provide this information, some of them just don't know. If you put it on our radar, we probably want to know. So now that I've talked about the grim reality of why people don't know about PrEP and PEP, what can we do to fix that? So from a top-down approach, I think the best thing is that we aim for public awareness, whether that be through campaigns, through public health, through organizations such as this, or us even now today talking about it. It's fantastic. It'll get the word out. We can talk about PrEP, normalize it, so that we can bring it up in regular conversations. And by doing that, people are able to learn about an amazing, safe, effective drug that can have such amazing, fantastic, positive impacts. The other thing is, from an individual perspective, if you are comfortable with talking about it, speak up. Talk with your friends, bring it up, talk with your family, talk with your healthcare worker. For me, put it on our radar so we doom scroll and learn more and more and too much about PrEP so we can share that with the rest of you guys. So for those that can speak, thank you. And for those that aren't able to speak up yet, we can be your voice. So thanks for having me.
Thank you, Pam. Oh, you can stay if you want to do questions and answers.
Okay, I'll sit
I
down.
just want to say also that it's interesting because Netflix, who's not a sponsor, but obviously should be a sponsor of No Time to Wait, I've noticed that they've talked about PrEP a lot in the newest series Uncoupled with Neil Patrick Harris, right? They brought that up several times, and I thought that's very good, right? That it's on mainstream media and they're talking about it, it's getting normalized. Also, Amazon, not a sponsor, but they also did Fire Island. Fire Island, anybody? Yeah, right? And they also talked about PrEP. So I'm thinking, like, I think that we are making progress, especially in those media streams, to raise more awareness, and it's very normalized when they show it. All right, so what questions do you have? I have a lot more statistics to throw at you. I won't, but
There are a few questions from the stream.
great.
For one, can either speaker speak to the reality that most ERs don't actually know PEP guidelines and therefore is often underutilized / not prescribed? Like, it's great to share information, but the reality is, for the most part, PEP is not accessible.
Pam?
It drives me a little insane. So since we're located in Toronto, it's harder for us to realize, but in Toronto, because it's a metropolitan area, PEP is everywhere, so it's super common. Like, we know what it is. But you're right, in rural areas, people don't know as much. But the thing is that there's plenty of information out there. Katie has guidelines. St. Mike's has a pocketbook for like healthcare workers to look into. There are clinical trials supporting which types of regimens that are available. So I think that this onus falls onto healthcare workers to learn more. I've had in my job so many random doctors sometimes just call us and be like, hey, I know that PEP is a thing, but like, why don't you? Like, how do I do this? And the thing is that, like, obviously it can be that guide for them, but there's so many other guides that are there and that are available for free, and it's our responsibility as healthcare workers. Sure, we might not formally learn about it, but we're supposed to continuously learn. That's part of our job. So I don't have an answer to why more don't know, but I think that hopefully by starting this conversation, more will know.
And then I had a question for Yvonne. When you talk about the pre-pandemic data, where was that data sourced from? Is that from your study or from previous studies? And how did you guys work with that?
So we just ask people to compare. So we say reflecting on pre-pandemic versus your behavior in the summer. Yeah, so it's their own data.
Okay, that makes sense. Thank you.
Can I add one more thing? PEP isn't also for like sexual encounters or anything. Healthcare workers should also know about it in case there's like needle stick injuries, people who inject drugs. So like, healthcare workers do get a lot of needle stick injuries, so it should be something that's known throughout like the world as well. So healthcare workers, learn.
Any other questions? Yep.
Okay. No. So yeah, how do you feel about healthcare providers, and like maybe homophobia might be an issue as far as their willingness to learn or prescribe PrEP and PEP and stuff like that?
So the reality is, and this also applies to like, I don't know if you guys know what MAID is, or medical assistance in dying or abortion. Sorry, separate. Like, it's just because like what they've taught us in school is if you don't believe in it, you should be able to delegate or tell them where to go. I think the bigger situation, and we're going to take a step back, is are you comfortable coming out to your prescriber, right? So in those cases, there are other avenues you can seek. So we're an online and in-person clinic. There's a couple of others that are available should you want to pursue other care. But if you don't feel comfortable coming out there, you can do that. Otherwise, if you're comfortable going out, but they don't know what to do or don't know necessarily how to approach that, they should be able to delegate you elsewhere. The benefit to society outweighs the risks to that healthcare worker.
Thank you.
Other questions? Comments? Ari?
Yeah. What do you guys have to say for young leaders and activists who are trying to get into the space that kind of want to help perpetuate the new narrative of like PEP and PrEP in kind of the mainstream? Like, is there any actionable steps? Are there any programs?
I just want to quote what someone said yesterday: be mad, be loud in a constructive way. By talking about it more normally, we can normalize this so that hopefully stigma falls to the background. Obviously, that's going to take some time. If you yourself want to help out, I think LetsStopAIDS is fantastic. They always take volunteers. You can also reach out to your healthcare workers, see what they want, if there's any gaps there. I think that just being a huge advocate or ally, so posting on your Instagram, so that people that might not know about this, or those little pockets of people that don't know of each other, we can bridge that gap between them, start the conversation.
And I'll just add that this is one of the reasons we did this survey, was because we knew people didn't know, but we don't have numbers. So getting numbers was really important, because that's also what gets your attention, but also what gets the attention of policymakers. Right? For them to actually see that there's so little knowledge about it is really important. To quantify it and to say this was a nationally representative survey has a lot of value. And we have taken this survey to people who make decisions, policymakers. Senator Cormier, who was here yesterday, has read the report. We presented it to Dr. Theresa Tam. Right? So having the stats, doing the research is an important first step to solidify the things that we already knew in society. Yep, Ari?
A question from the chat on Hoppin. What is the biological mechanism of PrEP? Does it stimulate the release or production of specific cells and proteins? Are there any hormonal side effects?
Wow, sounds like a question for a pharmacist. So PrEP is actually a combination of two different types of antiretroviral medications. So what it basically does is it doesn't stimulate any new cells or any new growth. It sort of acts like a barrier so that the virus isn't able to better penetrate your cells. By having two different mechanisms that reduce that virus from getting into your cells, that's what keeps it out. So it doesn't actually change your immune system by any capacity.
Pam, I think that raises a really good point, that this question raises a good point, which is also just misinformation, right? So there's stigma, but there's also misinformation. Some people get some information or have some ideas about it and then pass it around, and then it can scare people, right? So this is important to have conversations like this, to have groups like yourselves and LetsStopAIDS to kind of not just educate, but also dispel and get people to unlearn these things that they might have learned. Other questions? I think we have a few minutes left. Does this resonate with, do the findings resonate with many of you in terms of your own experiences of the pandemic, of dating, of concerns about mental health and young people, concerns for young people? Yeah? Yeah, 18 to 24. But I feel like we focus on 18 to 24, but many people experience this, right? We were all suffered under lockdowns. We weren't, at one point we weren't allowed to leave our house, right? We weren't allowed to leave our house, or we were only allowed a certain radius. We had to bubble. Remember bubbles? So many of us lived under these structures, and I think it's just important to highlight the experience of youth, who I think are they are always left out in policymaking in general. They don't have, especially people who can't vote. This generation that we surveyed can vote, right? But those who can't vote are often left out. They're not considered in policy making. They're not considered in a lot of the awareness campaigns, right? And again, this is where organizations, charities like LetsStopAIDS comes in to fill this gap. It's really important work. It's sad we have to do it, but it's absolutely necessary. Ari, we have a question in the back. Ari.
I know you might not have the answers offhand. Did you say 11% knew about You Equals You?
Yes.
So
only 11.
Was it more of male versus female?
Let me find out. So if you guys download this online, we break the data down pretty well, so you can see.
I can tell you I read it. It's very beautiful infographics, pictures everywhere, big numbers. It's very nice.
Let me see, 11%. Okay, so you can't see this, but we do break it down. So I'll just go across the board. 7% of people who identified as heterosexual know about U equals U, 12% for bisexual, 33% for gay, 15% for lesbian, 46% for two-spirited, 10% for those who identify as queer, 3% for asexual, 8% for pansexual, 18% for other.
Okay.
We didn't there. I can find that out for you in our data set.
What's the link to the report?
The link to the report, I think you can find it from the website. Yeah, I don't think we have a specific link, but it's called Sex Lives Report. But we have a lot of data. There's also some fun things that we didn't share, like a lot of you and the youth engaged in backsliding. Any backsliders in the room? It means people who, during the pandemic, contacted their exes and their old dates and their old flames. They're like, hey, what up? How's the pandemic treating you? Wanna meet up? And that's also very logical too, because from a risk perspective, you've already had sex with that person. You already know how sexually adventurous they are to a certain extent, right? So that's what happened. But in our report, we also warned that there are downsides to backsliding, which is that people should not be used as entertainment. So just because you're bored in a pandemic, you shouldn't contact your ex for fun. A lot more of you sent nudes. Guilty. Did you definitely say?
This is actually jumping back to something that Yvonne had in her research, which was that people didn't know about the cost. So just separate from that, for those that have health cards in BC and Alberta, PrEP is free. So talk to your healthcare worker. In Ontario, if you don't have any other forms of insurance and you're below the age of 25, we have OA Plus that covers PrEP as well. And if you're out of those ranges in different provinces, I'm sure there's other ways to help reduce the cost of PrEP. When I was in school, the first thing we were celebrating was that PrEP came off as a brand name drug. So now there's a generic form. And because there is a generic form, it is more affordable. Mind you, it's still a little expensive, but there are usually ways to help reduce that cost. So definitely reach out to your healthcare providers and see what they would suggest.
Did you say that in Ontario that under the OHIP 25, it's fully covered?
Yeah, if you're OHIP plus. So if you don't have any other private insurance, you're covered by your health card until the age of 25. On your 25th birthday, they cut you off. But up until then, it covers PrEP.
And not PEP though?
It covers PEP as well.
Really?
Yeah, those medications fall under that for OHIP plus, and people don't know. So if you're scared about that, I would say go do that first, figure it out, figure out costs later. See what's out there, see what's available before you even shut it out without even trying.
We have 6 more minutes. Ari?
We have a few questions from the chat. Basically, kind of stemming off of your point for accessibility and fundraising, there's a question that's saying a lot of vulnerable people that don't have funds to buy them. So in that case, where there is that lack of funding or is there that inaccessibility, are there any things that those individuals can do to access this medication?
So I think that the first thing was that just talking about the health cards and the different provinces. Unfortunately, not everybody has status in Canada. There are some avenues to seek access, but the thing is that I can only speak from Ontario, and this is a nationwide province. So honestly, best next steps is to speak to the healthcare team that you are in like contact with. So your doctor, maybe your doctor can sign you up for some patient assistance programs or patient support programs. Your pharmacist may know more as well. We deal with costs all the time. So there are people and there are support networks. Mind you, it might be hard or it might take you to step out of your comfort zone to reach out to them, look into them, but they are there. So the PrEP Clinic, Ontario Prevention Clinic, mainly focuses in Toronto, in Ontario, all of Ontario, virtual and in person. But I don't know as much about the other provinces other than the fact that BC and Alberta have free PrEP across the board if you have a health card. Yeah.
Sorry. And there's another great question from the chat regarding the medication and its specifics. Are there any multi-drug interactions for PrEP and PEP that one should avoid?
Great question. So this honestly depends on which medications are chosen. So for PrEP, technically speaking, there's actually two different types of medications used. Truvada or generic Truvada, which is emtricitabine tenofovir. So I'm going to go full pharmacist here. If anybody has follow-up questions about that, just let me know. The other one that people also use is called Descovy, which is emtricitabine tenofovir alafenamide. Oh my gosh, I don't know who names these. So for Truvada, that one, there is not as many drug interactions. It's not cleared by the liver, which is where most of the drug interactions happen. It's mainly cleared by the kidneys. So it's anything that could affect the kidneys or the clearance. So I think the most common ones off the top of my head, and this is mainly with like long-term use, would be like Advil and Aleve or like anti-inflammatories that fall into that category. Mind you, short-term use like for a headache usually is fine. And part of the process of being on PrEP, they monitor your kidney function to make sure that you're tolerating the medication fine. With Descovy, I'm not going to go into the detailed mechanism unless you want me to, but it's sort of cleared by the liver, like it is related to something in the liver, something called PGP, and it's also related to kidney clearance as well, but albeit not as much. So with that being said, there are a couple more medications or things that could affect that type of PrEP, mainly St. John's worts, in addition to like the same like issues of anti-inflammatory medications, but definitely talk to your pharmacist for that. For PEP, there are a couple of different like regimens that can be prescribed. So that really depends on which medication, and each medication has their own interaction. So please do let whoever is prescribing it and whoever's filling your drugs know what you're on so we can make sure it is safe for you. Okay.
Awesome, thank you. And then just one comment for any of the audience. Anyone who's interested in the Sex Lives report, the link to the report and the PDF is available on the chat. So if you just log into Hopin, it will be pinned in the chat so anybody can access it from there.
2 minutes. Any burning questions? Any comments? Were you shocked by all of this? Did you learn a lot about PrEP and PEP and U equals U? Okay, great. Yeah, yes, thank you. Last question, and then we're done. Oh, yes. Somebody else should explain this. Shaman. Oh, do you want to explain? Yes.
So U equals U is basically about medication adherence for people who are living with HIV. So if someone who is living with HIV is consistent with their medication adherence, then the possibility of them transmitting the virus to their sexual partners, even without a condom, is basically zero. So not only is it important for people who want to, lower their risk of contracting HIV, take PrEP if they're with that. Also, medication adherence is also a way to lower everyone's risk of transmitting HIV in the future. So there's a lot of pros for, especially with one's own health, with taking your HIV medication and being consistent with that and lowering your risk of transmitting that to your partners. So U equals U is a way for the medication to equal everybody's you guys get what I'm saying. You guys get what I'm saying. But yeah, did I get that right?
Good job, yes.
Yeah, okay.
And it stands for undetectable equals untransmittable. Yeah.
To a minimal viral load, that then you're not in a position to be transmitting it to anybody else.
And U equals U also helps to fight a lot of the stigma.
Yeah.
Yeah.
But we also have to caution that in terms of U equals to U, it's very specific to HIV viral loads.
Yes.
And not STIs.
Yes.
Yes.
Thank you. All right, well, I think that's all. Thank you so much for being a great audience. Round of applause for Pam
And myself.